He's the one who wanted the others poverty. Not a small way. You have they are practical. You have blue also. Every water vision class. Yeah. Dogma can't be tests. That's right. And this is international. It's not smooth. You sleep. Easy. Put a small black one, right? Then empty it. Then empty that one. Okay. I want people many vision tags and take So this is ARDD or any macular disease, right? Right. So this one, now in diabetic retinopathy, you see some areas dark, right? Some areas light. That is diabetic retinopathy. Would not be 6. With all the things. That is not true. Number four. Yeah, that is only a dark area here. That is ischemic optic interval. You get a horizontal shading. Six one, you get hemianopia. Why you get hemianopia? That usually means market. When you have a brain tumor or brain lesion, right? University, you get up to the center, a little Iraqi and the you get half filiated, so 40. In both sides you get. So from this side also this half bone, from this side also this half bone. So that is bitemporal hemianopia. Hemi means half. So you get half to right? Otherwise you get sometimes shorter, quadrant. Okay. So depending on the brain lesion, where you have the tumor or disease, you get that visual field defect. How do you know when you do a visual field test? It's a brain thing. I need to clean the eye. So you have it is like that. Don't have pictures.
You should make for both lenses or
Hemianopia, you put both lenses, right? You put how many pairs are there? Six usually okay, you have one half covered and keep another half cut, then we will see how it works when you put the don't waste it. We'll see. Hey, no, hey. Other two has become brothers. This is a very important lesson. So, how we are doing ocean assessment, we are doing this. So, this is very important if you are learning. So, all of you are interested in ocean or just for the sake of doing the ocean? Are you interested? Yeah. AC full name. Game is the next. That swing is a lot. swing is happening in a minute. You don't have. Swing in pan again, but never. Just getting. Pan Yeah, pretty option as well. They are in the color yeah. Then you can see one eye is affected how you will see. With both eyes affected how you will see. Huh? Kita kalawan and put the other. Yeah, there is. And he another one but we say something. Then we see both eyes affected how you will see. Tahu kita member kalau itu. No. Actually, when you are doing big pain, you get glasses like lights, right? I just wanted to do it because when you do it yourself, you will keep it in your mind. Thank you, so Okay. When you come to my class, you put a meantime with the paper and put the thing on the side. Why you can remember sharp marks? This. Otherwise, I can't really go all of them. And Structures are AI and something that's really interesting. Then another good banana on that. Everything you have there. We pass us and we you know how works and how we you make a picture like this with all retinal layers. Banana and AI will be having a three-dimensional is not another. You make one like that, always keep it in the class. Then you can remember. Udah mengasihlah hadang. That picture is also good. In our baby very much. Finish. What we reached. Finish time. Good. Keep an extra one for the other. The other one we pass. Keep the same thing for the other. So we'll go through the number one, right? Who has the number one? Who has the number one? Yeah, it is. Unfortunately, we don't have a vision here. So, see the chart. You can see how you see this. How you see this. You can see on this whole line and see the whole line. What you are missing now? Next, now. Now, once. Put the other one also. Other one, extra one, capital. Kapan then. Who has the number two? Number two is diabetic retinopathy. That's Spanish. How do you see? This is near and there now. Right. For the other one, also in front. Now how you see? This is. Who has number three? Number three. Who? I have it. How you see it now? I just say now. They put the other one also on the other. Huh? I know. No, but you don't need a data. You can hold it and see. Take another one. Who has got number 4? 4. You have, right? How is it? Number 4. You but 4, what's not the one? How do you see that? All you can see. That is because your one is low. Right? Look at the flow one. Right. So have you got an extra one? Have you got an extra one? Extra one? एक product unique color unique is equal. Yeah. High level and unique. High level and up, right? Not down. Who has got the number 5? 5. Now how do you see? Okay, all you can see. Can you see all the pens in the classroom? So put the other one also and see that. Take number 6 then. Put it at 6. What you can see. Yeah, when I put and see. Nothing can be seen. But if you slide it there in your head, then you can see. Put the other one also see that. Now, I want you to extend this and see how we can see. Extend with the extra one also. I want you to feel how a low vision patient feels. And even at eye hospitals, people who don't know low vision about, they struggle with the vision chart. Very. But the patient can see. Deterring the pay to the piano, as a penny, Pahai decide, they will tell you from a pain. So, so you are struggling with the patient if you don't feel it, you don't know the real situation. Now, when you have this simulation, you know what the patient feels. If a diabetic retinopathy patient comes to you, you know how he sees, right? If a hemianopic patient comes to you, you know how he feels. Otherwise, you don't feel it. Until you have the same issue, you have to put the person into your own shoes and see, right? Then only you will understand the patient's real problem and the real issue. Right. Extend this, and I want you to see these pictures. I want you to see the flow, right? I want you to see the up roof. Listen now. What you want? Look at the pictures, scan the roof, right? Try to see each other. and look at the floor. Look at and there's a step here. You come here and see how you feel the step pause. Right now, exchange 1 and 2 exchange, 3 and 4 exchange, 5 and 6 exchange. Right? And in glaucoma, you see a connection of so retinitis pigmentosus. Those are also the same. See, stand up and feel all these things, flow and the roof and the step and the chairs and friends in the classroom. Okay, come here, the number one. Come in front, otherwise I can go. Come. Come all of you here. Come all of you here. Come all of you with the extra one and all that. Now, where it's time to see. Come here. Right. Now, all together, look at the flow. Look at the flow. With your these defects, right? Look at the flow. How you feel it? Look at the flow. How you see it, right? Right. Now look at all around the classroom. Do you see your friends' faces? Do you see where they are? Are you missing any parts in the classroom? Right? Okay. Then look up on the each one I want to see. Right? Look at the roof. Yeah. Now look at those pictures there. They are there on your opposite side. No. That side. Opposite side. How you see? Now, okay. Now exchange it. I want you everyone to see it all. Experience all though. Like just like I did, look at the flow, look at the curves, right there. The step is there, how you feel the steps. And look at the faces, especially when you have ARND, you can recognize the faces, right? You can see how their nose is, how their eyes are, how their mouth like. So when you have ARND, difficult in recognizing faces. After So he's walking, see that see. So and see the curves, see the steps. If you want, just walk outside them and stay at basic License, yeah, yes, sir. Just go walk with that and see the stairs. Yeah, relax. Yeah, don't fall. Not quick, yeah, in about 5 minutes time. Okay. You had a good experience. How the stairs, the stairs. They are now paused. Now, each one of you know how to do it. One part that the data have the real effect. How each one will see, you know. I mean, okay. So when you describe it, in number one is age related microdistinction. So you get the central defect, right? You can't recognize people. You can't see properly the nose, these figures, central features, and that's why you can't recognize people, right? Then, if you take number two, means diabetic retinopathy, right? You get pseudomas here and there. Right? Pseudomas means non-seeing area within the seeing area, non-seeing islands of vision. So you have some areas here, some areas there. So that is why diabetic patient comes. When you ask them to read the board, they do this and this and this. So they find the number. Right? Then number three is yeah, you can have some areas blurred here and there. So, yeah, it may be a central archway vision. I mean, glaucoma, you know, sometimes it starts with the central defect, right? Then it continues like archway. So, it may be that you are having scotomas of vision, arcuate defect, starting glaucoma like that, right? And in number four is yeah. You get the central, sorry, the horizontal defect. That is, then you get ischemic optic neuropathy. Right? You get the central defect. You saw how difficult going steps up and down like that. If it is on the superior wing, looking up and coming stairs up is difficult. If you have the inferior defect, that means in the lower wing defect, going stairs down is difficult. Getting down from a bus, getting down from the train, so walking on a pathway is difficult. Then when you walk on the road, you don't see the pavement, you don't see the road, you can't differentiate the gap. So those are difficult. Right? Then in five, number five you get glaucoma. So that you have a tunnel vision light. You see, now if you are in classroom, if I look at you, I will see only you and I don't see other chairs and other people. So they go and bang onto objects. The party somehow they are running and so others don't understand. So they are Sabu, they are music sample. So they don't see any different. So when they can't see the surrounding, they go and bang onto objects. Right? Driving is difficult. So that is the glaucoma defect. Right? Then in number six, did you see that half a going to invent that current? So you can get by temporal hemianopia. Second, you can't see the left side, right? Sometimes by nasal hemianopia. Then you see only the surrounding, make the painting. Then you have to do like this and this to see the objects, right? But you have a secret to tell? See? You have a secret to share? You have any difficulty? Okay, now we underwent that. Actually, I really wanted you to feel the profession patient's experience. That's why I did it. So anyway, I do a class, I do this simulation exercise. Then only you will understand the difficulty the profession patients are under. Right? So today then we come to the today's lesson. Then when you assess vision, when you do the option and not option, just vision assessment. What is the purpose of visual learning tests? What is the purpose? Then after another patient, maybe the company. Yeah, check the balance. Why we check this? One of the balance. Why? Mental like one, insulation, you know, on the name. So how do you do it? For what we are doing it? And why we are doing it? Get some idea of the remaining vision of that patient, no? So, so what are the other purpose of vision testing? Okay, you may be in an optical shop, you may be in 3D. So what's the purpose of vision testing? Bukan berdiri, yang barang, mengamplan, barang. Very good. Correct. And give maximum vision and maximum comfort. Right. So what else? Okay, if you are working in a hospital, not to correct, then why need to? Right, very good. To recognize any diseases, underlying diseases. Then after the eye hospital, OPD, the patient, doctor, ANAs, will have to for what? Do the refresh. Because it seems whether it is improving or not. That is why there is a huge crowd in the optometry part. Come to the eye hospital in the morning. If you get 1,000 patients, about 600 patients are sent for refresh. The doctor will see there are zero refraction failure. So, you say, parameter woman to recognize whether there is a disease. Yeah. So, what is? What is? We income first. So HP early detection of disease, right? Early detection of disease. So when you do the refraction, if the vision is improving up to 6.6, you can say there's no big issue in the eye, right? Still there can be some issues even the vision is 6.6, there can be maybe in glaucoma you are having, right? So maybe some accommodative problem. So still there may be, but you know there's no big issue if you are having 6.6 vision. Right? Then helping early detection of diseases. Now if you get a cataract patient, so when you do the refraction, if the vision is not improving 6.6 or 6.24, you know that this patient should go for cataract surgery, not for glasses. So that differentiating the disease. So what you do is vision testing is very important, right? Then proper management of eye conditions. Now there are some conditions they need some injection, so they need eye drops, right? Or they need some other treatment. So for that, the vision assessment is important. Now, correct the refractive error and make them functionally efficient and comfortable. Now, if you are having 636 vision, so vision testing and with glasses, if the vision improves to 6.6, then the patient will be more comfortable. More comfortable and functionally efficient. Now, we say 636 vision, whatever he could do, now he can do it in a better way and more speedy. Right? So then after vision testing and correcting, you get efficient and comfortable person. Now, for example, this patient is comfortably reading in the train. Now, when you give glasses, it's more comfortable. Otherwise, he could have strained a lot, he could have done this. Today, so now he is, even with traveling, he is reading with glasses very comfortable. And then provides a complete understanding of eye health and visual performance, right? Then you can understand the patient's situation by doing vision testing and vision assessment. And you can, and about their visual performance. We'll say, now we'll say the vision will improve, but the visual field is now as you experience. If there's a visual field defect, you can understand how to measure situation. That is why you do this vision assessment. Right? If anybody comes to the eye hospital or your optometry practice, the first thing you do is vision assessment. So then you have some idea. You can see whether it need to be corrected, it need to be given to an eye surgeon, right? He needs surgery, or if you have a good idea of his vision assess, then you can plan what you can do. Now, with the purpose of low vision assessment, right? It is completely different because මේක බැක් එකට යන කොහොමද යන්නේ? right එක කොච්චරද? බලන්න. Right. Oh. Right. Now you can remember here what are the purpose now? Management of eye conditions, detection of disease, and correct the refractive error, and to get a complete understanding of eye health and visual performance. Right? Now here, this low vision assessment is functional because here you have to plan what you can do, understanding his remaining vision. So here you do the assessment to understand his remaining vision. What is his visual field like? What is his vision like? Right? Whether he is sensitive to the glare, then he has problem with color vision. So you do whole lot of assessment, get a very big, clear picture of the patient's ability, what he can do and what he can't. So that is all this result oriented. Now what we do the reflection and send the patient to the doctor or counselor. But here you have to plan what you should do from here onward. Right? This completely in an optometric part. Okay. So not eye surgeon's part. Because whatever he could do, he had already done. Remember, they had done surgery, they had done medicine, they had given all glasses, and that takes us or if that surgery anything now. So only he come to you. So you could have to do the result oriented assessment. Here, to assess the residual vision present and correlate it with the individual's visual needs. Correlate means what? Correlate. Main thing මෙයාට කරන්න පුළුවන්. Goal understand signal. Main කියන condition එකෙන් මෙයාට කරන්න පුළුවන්. Right? Main කියන visual reject එකක් එක්ක මෙයාට කරන්න පුළුවන්. How you can help them to do it. But you understand that is why you understand the patient's residual vision, present and correlate the visual needs. And visual needs වගේක් වෙනුනේ patient. දැන් මම regular refraction කරලා සාමාන්‍යයෙන් අපි කරන්නේ ටිකට් බලන්න. lenses ටික දානවා. patient කාට කියවන්න දුන්නා ඒක කියලා. Right? Here not like that. Right? Self feature නම් දෙන්නේ මේකෙන් ගන්න කරන්න පුළුවන් මොනවද advice. Right? So and identify ways and means to enhance the visual functions. ඒ කියන්නේ යාට කරන්න පුළුවන් දේවල් තව වඩා කරන්න අපි යාට කියනවා. Now for an RP patient, now retinal pigmentosis. If there's deep line like this, it's very difficult for her. So if you ask, instead of that, if you ask him to like this room, make this room very big, you have good illumination, it can function properly. And so that you have to advise according to the remaining vision, according to their eye disease and condition and the proper plan outcome. So this is different from clinical assessment. That is why option is different from clinical assessment. So that is why we go in detail and do it. See. Now, if a normal patient comes to you for refraction, glasses correction, how much time you can spend on one? How much roughly you go? Have you done refraction? How much time? Okay. How much time? 10 minutes. 10 minutes. So you think how much time you have to spend on low motion patient? Right? Yeah, now 40. Yes. Ideally that 40, right? Maybe 1 hour sometimes. But at least it should be 45, right? Because you have to be very patient with the ocean. Now we saw how they see, no? They can't, now if you ask them to see straight away, they can't read the book. It takes long time. So you have to understand why is reading slow. It takes about 45 minutes. That's why some people don't like to do devotion because it's time cost. So you have to have really patience with the patient. If you don't have patience, don't select those. Then refer to someone who has experience and gifts. If you are willing to spend time with the patient, if you are willing to understand the patient, right? You are going to choose and understand. You have to have empathy, and not the sympathy. You don't have to have sympathy, but you have to have empathy. You have to feel about how he sees, right? And what's the feeling he gets. Now, if a young person suddenly loses vision in both eyes, so you have to have the feeling how he will feel. If you don't have the feeling, you can't do good. Some lotion patients have it's not normally you have it good. The Mari came there, you can't understand. Sometimes when an old patient, they can't read the things, right? And they can't read the tone, sometimes they have all the numbers. So we can make patients the patients. Now, this is the low vision system. Now it consists of something. I will help. Then what is effect stand for? Very good. And you see, major values. Now, appropriate methods. Yeah. Yeah. So you have to do all these things in the case. They're not just vision test. Yeah. So let's see how you can do it. Now observation. Now as the patient walk into you, you have to see how he walks. Yeah. So if he doesn't have the proper eye contact with you, that means he can't find where you are. Otherwise, what will happen now if you are coming to a doctor or somebody who is practicing? What will you do? Now, when I open the door, what I am doing first? If you enter a room, what you are doing first? What you are doing first? Right, good. Now, then it says, wow, opening the door, then what will you do next? What you are doing first? Sabi dia, kalau tambah itu kan, jangan berapa mau beli kan, asik bina, mau beli kan. How that lady kita mana? So you do stand, that's do standing. How that lady kita mana? So if you are coming to a doctor, going to a doctor, what you will do? Then one of the channel करता channel निकाल डाला इतना, right? And your appointment comes. So you open the door and go inside. Parang muli magkaroon. Huh? Huh? Good. Tag karoon eh. What you are doing first? Huh? And you are doing first. Now the doctor is again now like side the door. So you are going into the room. Enter in the room. So what you are doing? Look at the doctor, right? You see what of the doctor your doctor inside. Like what you are looking. Face. You have eye contact with you, right? So if your vision is good, you first have the eye contact of the person who you are going to meet, right? So like that, the patient comes from the room, what he is looking for? Looking for you. So he is straightly looking at you and he has the eye contact. Now, first, when we read the weights and what the first thing we do is we have eye contact. So, the weight and vision is poor, we have the eye contact. So, then you can see that his vision is poor because that's why it's not looking at you. Right? Then you have to see how he walks. Right? You have to this. He must be very lucky. Right? That are good with happening. So you have to see how it walks. By an sure answer in the beginning. Right? Then using walking aids. Right? Parallel calendar using a white cane or walking in the sun. Then using tactile sensation. Right? Using tactile. So they can't see properly, but to do. And kalau boleh sekarang kita tunjukkan, you feel like they get the information feeling. Tactile sense. They drag the feet. Cardiac feet, that is, yeah. The money that you cardiac better about so in the feet. Then you see the side at that. Then can highlight these lines. So you have to do all these observations interesting too. So you will not information when you observe. In fact, observe when it's interesting. So that is observation. Then what is that? See, read it now. What is it? Spouse. What the spouse will. So these all are important for the overlook of common relation. Otherwise, you can't advise. Why job is important? Why the job is important? You have to understand this important status. Now you are writing in very expensive prescription, right? You say for doctor, all anti-defective, Pixar or science text or something of it, writing very expensive prescription. It's not practical. For writing super high index classes. I don't know whether you have idea of what stuff was. Yeah. So, before you do all this, you have to know about data series, right? Then Monday to the get the medicine that get. Whether you want time or other way or somewhere really remote area where you don't have this. I asked you to have more illumination with lights. So which is not practical. So that is why you have to have some idea of the patents, economical status and social status. So all these things you have to get an idea. So what is his job and what is his spouse? You can say a housewife, but she doesn't have proper income. You have to know what's his husband, what's the family support he gets. Why the children are important and they are eager. Sometimes they need children are employed children so that they can help them. So sometimes they are small children. So This patient has to do all this paid orders for the school going children and who don't have proper income. So those are very important, right? Then what are the daily activities from morning till sleep? What are the things he does? Right? One of the experience I wanted to give classes for a lady who is a cashier. And lady, that's her like outlet. And she's a cashier. So she's doing the first job and is standing doing all the work on the cashier. So I gave the classes for that. Next day, for 2 3 days after, she comes and says, I can't see this class. This class. So I found to see because I have corrected for that distance. So she says all the time, I read the newspaper, lying in the bed. So I know that's what she is doing the night. So I wanted to correct the one. Daytime, I got only short information. So if I got more details, and if I talk to the patient and got more details, then I will have corrected for both. Even in Angadhyana, that patient was a very big short in around sector. He has been so he is 93 years old. He lives alone in the house. Now, the whole day he read the newspaper while lying on the bed. Okay. So somebody has given me bifocal glasses, which is very difficult for me. So you have to give him a separate glass. That's the only thing that he has gone every day, and nobody has a solution for him to give him those needs. Right? So like that. So you have to get the idea of this daily living activity from morning to night, but he does at home. He may be reading, right? The ladies there, she may be cooking, she may be washing, right? So she may be going to school to take children from school in the daytime. Yeah. Each one is different. Now if I take all of us, we each one have a different visual needs, no? Even though you are the same age, people each one has a visual needs. Someone going to put the theory and get the one for the theory. Right? So I get the young one and the one someone that are being a good but you can see that but looking at your size. So like that, right? So different visual needs we have. For me, I have 40 different visual needs. So like that, you have to get the idea, what are there, they will be. Sorry, I can't remember your name, son, to speak with your name. That's why I need your name tag. At least on Sunday, and comes get for a name tag. We like to call by your name. Okay, then about family history, the family members, whether parents having the same issue, whether the siblings, some it's anemia or retinitis pigmentosa. That is important. Though those are not important, you have to get the idea whether your siblings, grandparents had it. Why? Why? We say a retinitis pigmentosa patient comes in. Do not definitely this patient will be blind when he is already 6 weeks or 7 weeks. He asks from you whether I'll be blind. You can't straight away say, yes, another 20 years time you will be blind. Then what you are doing? You are doing a big mistake because he comes to you for a big solution, but you are making it very bad. Right? He will go home and start the law. You can ask whether your parents had it. Whether your grandparents did. Yes, I had one grandfather or maybe grandmother who went blind when she was about 750. So without telling him straight away, you know that he will understand that he will also be blind. Means you can say you may be or may not be, but you open the door to think of that pathway. So that is why It's very important, right? So maybe you can ask, but they ask for you. The mama blind wait there. But you know, you have an elder sister who is at home, blind don't tell it. So that when you ask, they know that there's a relationship with all these things. Somehow whether you not see a very blind woman. Then the parents come to this kid who has the same condition and they ask whether this diabetic blind. එතකොට අහනවා විද කවුරුයි නන්නේ සිදට මේක කොහොමද පරම්පරාවකින් එකක් තමයි. Then they will understand they that this child has the same issue when he becomes that age. Right? So that is why this family is very important. Consanguinity. What is consanguinity? What is consanguinity? Don't know that good. What is consanguineous marriage? That is, you are marrying your blood relative, usual first cousins, right? So, if you have a consanguineous marriage and you get a patient with aneurysm or something, you know, aneurysm is what I told you last week. So it has got a strong family connection, right? So you know, if one patient is aneurysm, the next time will be, it's about 80% sure that this will also come as aneurysm, right? Now, did I told you last week for this that week, right now, maybe last week, I got coaching, that they will lose very high myopia. One child was about 5 years, and the other one is 1.5 years. But believe me, they had -15 myopia, both children. And they are from Hyderabad or something. And again, we got admitted into the Optometry hospital, and they said that's for lotion and sister. Both children had -15 myopia. So if they ask whether the other child is going to have this, there's a big chance that if to get a third child, he or she will also have the same issue. So they are having a big problem with financial because their father is a retired young person who is earning about 60,000 per month, and they have to come to our hospital immediately in 3 months' time. So financially they are down. Right? So if they have another child with the same condition, how they will suffer? So that you can advise not to have some other children. So we can advise about family planning. I don't know for you it's love, but in other communities it's love. Right? So in Pakistan and what when I got the training, they are completely talk about family. They can't talk. So, but you can simply say, don't have anything because you don't have the same suffering to get the number of time. So when there's consanguinity and when it is a consanguineous marriage, the chances of getting the defective vision children again is small. This is why this family history is important. Then the ocular history, how long had it affected then men? Now, usually, when you have an issue, some medical issue, what you do? What you do? No, I mean, you have a reduct, first thing what you do? Consult a doctor. When he says, you can't do anything, sorry, you have to suffer with these diseases. Then what will you do? Let's see what will you do. What will you do? Can you adopt it in the field? We will on the current there. So next thing what will you do? Oh my God. You go to another doctor. Right. He also says you can't do anything when all of this. What will you do? Go to another doctor. Right. So again, some of the so then what will you do? All the Western doctors are telling you can't do anything. So that Ayurvedic or any other alternative thing you are looking for. Muraka, Murakuregina, Mahapadang, සමහර වර පාණ්ඩුවල ඉඳලා මහත්තයාගෙන ගිහිල්ලා මේ මොනවාද පත්තු කියනවා. So all they are doing all these things usually when motion patients come to you, they have gone they have gone every day, right? They have gone every day. Huh? When they come to you, it is better, right? So later the better you get the grade. Why? Why? දැන් යන දේවාලෙන් ඇඳලා තමයි මේ දෙවියෝ ළඟට එන්නේ. මොකද ඒකට බෙහෙත. හා? Right. That's very good. So that they understand nothing can be done to this. නැත්නම් අපි ඉස්සෙල්ලාම මම කිව්වා දෙයක් කියන්නේ නැහැ. Right? ඒකෝට අපි රිවයිස් එකක් දුන්නාම වැඩක් නැහැ. ඇන්ටිෆයර් එකක් දුන්නාම වැඩක් නැහැ. මට ඕනේ මේක හොඳ කරගන්න. මට ඕනේ මේක තව මොනවද කරන්න පුළුවන් බලන්න. right? ඒකලා පුළුවන් තරම් ડોක්ටර්ස් ළඟ ගිහිල්ලා ඔල්ටර්නේටිව් මෙඩිසින් කරන ඔය ඔක්කොම දෙන්න ඔප්ෂන් එක තමයි තමයි එක්ස්රේ එකේ accept you. Right? So that is why so you ask how long can you perform? පරණ වෙන තරමට මොනවද? Then any surgery, medicine goes, right? Then any systemic conditions, right? Now diabetes or something which has got variable results, right? Then any glasses using, timing very important. Timing very important. Now we are looking for a different thing from you, no? So why it is important? Now, if, for example, if it is using -1, you are also going to do -1. It makes a difference. No, so that's why knowing his present direction is very important. What's the glass using? Don't give the same thing. And the illusion devices. Like he is using already a hand magnifier. You are also going to give a hand magnifier. Don't you? Then it won't make any difference. Quality is using a 4x hand magnifier, you have to at least give a 6x or 8x magnifier. They make a difference. Right? So before you give or before you do any prescription dispensing, you have to know whether he has used glasses or whether he has used any lotion device. So whether he has gone to another lotion practitioner. Right? මට එනවා සමහර වෙලාවට අදාළේ ලෝෂන් පිළිගිරේ ගියේ තායි හොස්පිටල් එක නැසක්. හැබැයි මම report එක ගත්තොත් අදාළේ තේකම කරලා තියෙනවා. So you can't do anything else. So you have to make them understand. Hey, it's everything need to put down. So that gives you more respect when you're doing something fake. Right? Don't do it. They need to learn this. දැන් ඔයා සේව් කලෙක්ෂන් එකම දීලා සල්ලි ගානක් ගන්නවට වැඩිය ඉමුත් මේකම තමයි ඕනස්. මම කැමති නෑ තව එකක් දෙන්න. ආයි මොකනාවක් වුණොත් මගේ ළඟට එන්න. So that gives a good rest. Right? Don't give the same thing and tell a lie and no fake. Right? පුතා මේ මොකද්ද මෙතනින්? Huh? What's that? Oh, now comes to the visual identification. Have you seen a logman chart? Not really. Then you have done how to calculate entities and you know how to endpoint to each business. Right? They say patient at the point 0.79 and you have tested at 2 meter distance. So what's the log? Hmm? 0.3. So then how much it is? One log. You have done. Nice. Or should I be testing basically no? Yes. So he has done it in a lot of people are reading this. Right. If the patient is reading 3 of these figures and missing 2 numbers, so what's the logma? Now he is reading 1 logma and missing 2 numbers. So what you are going to do? Hmm? You add or subtract? Subtract. Okay. How many? How many? But 0.04. 0.04 because each value is 0.02. So if missing 2 numbers, you add 0.04. So it becomes 1.04. So you have that idea, no? So I don't need to do logma. You are an expert. Yeah, very. Okay. Then have you seen the Leah symbol star? No? Leah symbol star. You see? Now, now here, usually we do visual active testing for the option people with the log marks. Right? Snellens, if you don't have the chart, it's okay to do, but Snellens is not advanced because this is the gold standard in the world. Right? And this is a more advanced visual ability test, right? You have in all lines, you get 5 operates and calculated all the numbers and all the gaps between the figures and in between the lines. All are calculated. And the rate that reading ability is also calculated because if you take a line, 3 numbers which are difficult and 2 numbers which are easy. And so like that they have done. So this is more advanced visual ability test than the stencils. So this is the gold standard for low vision in the world. So at eye hospital, I am only doing visual ability testing with the logma. But still they are replaced with standards because it's one thing time consuming, one thing it takes a big space. Right? So, but in England and all, we are doing with government. Especially for diabetic retinopathy and all. This is very good because even a small defect in vision or small improvement can be identified with government, unlike the snakes. Right? Now, this is Leah symbols. Right? For kids who can't read the numbers, for kids who can't understand the other tests, this book, what I want to show you. Right? This is Leah symbols book. Okay. If this is very expensive gold like this. So only 4 shapes are there: apple, square, house, and the circle. When you can't see this, all see the patient like circles. So that is why these 4 symbols are there. You can't recognize, they will see all the figures as circles. But only four figures are there. So it is easy to be recognized by the patient. It's called Liasi. For kids, we are using that. For kids who can't read the numbers, pre-verbal children, especially nursery children and all, they can recognize these figures, right? Even the single symbol book is designed for testing children and adults who have difficulties perceiving symbols in lines. Visual acuity values measured with single symbols are often several lines better than the line acuity values in versatility in their fingers. This could feature single occupied line slices from 2200 to 2010. The oscillating mass specific this one I have thought about the single symbol group. Right, this is actually about the single symbol. This is some four numbers are there. This is single symbol group is like this. Only one symbol in the page. But you get this one 2200 to 2010. 660 to 63. Now if you take this book, first one 660. Six five three. Yes. 653 when I came on 6 from 662 653. Okay. So this is for kids, right? And if they can't, even there are some children who can't recognize the shapes also. Maybe shape figure, identify the variable. Then what you can do is you have a matching card. Right? Now you hold this. There's a matching card, not this one, but there are single figures are there. You give it to the parent or the child to hold it. And when you show this, ask the child to matching this star. Right? You understood it? So then either name it or matching it is okay with the clear symbols. Now this one. I have confused. So, see. Now, in infants and pre-verbal intellectual disability visual activity, both in infants. Now, is there a way you can test visual activity in infants? First, can we is okay. So this is called clear grades, right? One is totally blank color. Blank. The other ones shall having grades. Right? Now the one which has the smallest rating is the better visual. One which has the big ratings are the poor visual. Right? Yeah, we give the Mahadevi get 6 here, and we get it 6. I mean 6 and 8, but just to understand, right? So what you do is you hold the two in both times, the blank one and the red, and you look at the child. So which one the child should see? The red is one. Does anybody like the pattern one? Each like the DNA one. We like to see the pattern. So if you look at the child, if the child can appreciate the difference, the child should look at the one with the red, not the blank. So you can take events. If I experience the same thing, so that means he has that. Sure. So like that, you keep on going from bigger ones to the smaller. So this is for pre-verbal, that or intellectual disability samarayana. You want to very about me required no. Samarayana down sarimana symptoms numbers and I'll pick first one. That if you can say this. We are very accepting, right? So this is a detection test for preferential looking situations. The handle on each paddle allows the tester to easily administer the test. rating levels printed on each glass 0.25, 0.51, 2, 4, and 8 cycles per centimeter. Right? That means now each cycle is a black and white. Black and white. So black and white is a one cycle. So you get 8 cycles per centimeter, the better vision. Right? So 0.25 cycles in a centimeter, the poor vision. That is how you can measure. There is a way to compare it with 6 vision. I don't go into that detail, but you can compare this. But then this rating activity is better than this recognizing. So this is signing up about that in the element. Now, what is the other thing we test? Now we need okay. Now we did visual acuity testing. Then what is the other thing we do? Visual acuity testing for kids. Now we have to do visual field testing. Very much, please. This. So visual field testing, what you can do is you get from the visual field test, right? You have seen those reports. That will be on the reports. You have seen, huh? You are not working somewhere. Do you last working? No. You can start studying, no? You come and see. How many of you have seen the visual field reports? Which reports can you see? You have seen. Do you have a platform or you can take a one which shows the others? Just bring it. Possible, I will also bring one. Can you put a message that I will bring one? Huh? So you can do the harmful visual field tester and you can detect any central vision defects or peripheral defects. So there are different types of tests available in that computerized vision. Okay. So if possible, just go and see some tests how they do it and what's the report they did like that. Next week, if you give me a research, I will bring it. Now you get between monthly test checker, you get between 32 and 24 to here central test. So 64 is a peripheral test. So you can do either central visual field test or peripheral testing with the amplification. Right? Then have you done confrontation test like this? Have you done confrontation test? See, no? No, very good. Right. So with confrontation test also we can get a rough idea what the patient can see and patient answer. Right? Then you get the answer test. Right? දැන් මේ ඔයගලන්ට අහගෙන ඉන්න සාමාන්‍යයි ඔය ටික ඔක්කොම ඔයගොල්ලෝ කරන්න ඕනේ. Otherwise you can't get the idea of self-knowledge. So this is just a simple chart. Here see, this is an answer test. The details test is there. There's a big book. Just one detailed answer, but this is a simple answer chart. The patient vision is good. He should see the now you close one eye and ask the patient to see at the central white dot. Sometimes the patient is having macular degeneration, he won't see the white dot. But others whose macula is good, they will see the white dot. Okay. Then while looking at the white dot, ask the patient to see the other squares. right? If there are photomas or anything, half minianopias or anything, he wants to know, right? If there are photomas, patient will see some kind of there, right? So this is, though it is very simple, you can get a good idea of vision assessment with the answer this. That is center, only center. You can't take the peripheral. Then now you can see how patient is a normal test how the patient sees. Here you can see when it is abnormal, patient will see center dark spot, you won't see the white spot. We will see distorted areas like this. It's like gray squares here, right? Here. There are mobile areas. You will see some red. Do you understand? Do you understand? What you have done in clinical class? Hmm? No? Good. You have done? You are doing it assessment. Huh? Open hand. Have name like money? Do? You also have. Then you can want to perform the non-translation. With one of your training. You mentioned, Balangar. Balangar. Right. And what we do? Translation is doing and you are doing translation. Come program and take the class and do it for others to understand. It should be on a good distance. It's 1 meter or half a meter.
I should say the opposite. I will put it as
Yeah, perform.
model. Okay, then you know, then you know, go back in, next, then, and again. Yeah.
So, what do you say? Is it correct or not? Yeah. One should be first. So, the way we did it was correct or not? You started from the center. Is it correct or not? So, you can know it properly. That when you are doing the test, before you know it to the patient, you have to know it correctly. You have to first close one and ask the patient to look at that with his eye. Now, if you are closing your left eye, patient should close the right eye. And you are comparing your visual field with the patient's visual field, right? And you can start from the peripheral, the same, not from the center, peripheral, the patient not from here it goes, patient not going this way. No, you have to from non-seeing area to seeing area, you should, right? Now, for example, if you are doing with the patient so okay, for a normal patient, but for an ocean patient, you can start with the hand or with 2 fingers because we won't see one small finger or one small thing. So you can do it with 2 fingers. Usually I do it with 2 fingers. You start from here. I need to understand the patient can't see two fingers, you can do with the whole hand. Like this. Do it now. Close one, yes, you can. Yes, yes. Close one and long to one.
Shape those.
Yes. You have to take the patient when you begin to see him, right?
This process, first of all, I should complete the peripheral and come to the center or from one side peripheral.
Each quadrant you can. From here, from here. From here, then from.
No, I'm asking that from peripheral to center at once or after completing all the.
No, from periphery to the center. Periphery to the center. And he will say, when he start to see, he will say, yeah, yes, I can see now. Then you see whether your one, you compare the patients. Right? Now you can see here, patient see here, that means there's a difference, right? And you can see here, and the patient see here, then there's a superior difference. Others watch it. If they are wrong, then give me that pair of glasses who had
Yeah.
they don't have there are rules there. Rules. You power it means but it's faithful. Look how the nasal part is here. Right now, we are in doing. Now look at them. Now focus one line. Oh, then as recommended, because when you do for the low vision patient, you can do both eyes open, right? But if you are doing it for a normal person, you have to do one eye closed. Because why? Low vision cases, we are testing their functional ability. So that it is not diagnostic purpose, right? So that we can do both eyes open. We get the functional idea. But in a normal case, Shafan, listen to me. In a normal case, you can close one eye and do it because we are doing it for diagnostic purpose, right? But in a low vision patient, you can do both eyes open because we are doing it for the functional purpose. Not we are not going to diagnose. Right? So we do it with both eyes open and do it with both. Now see how the vision detects area, how the vision is seen. Okay. So you should cross the center line to see it. Until that we must see.
I came from peripheral to center.
Yeah.
Why center peripheral only?
No, you can again go from here to. Yes. Yeah, that's it. Yeah. So now she will see from this side because this half gone, but this half she can see. Okay, fine, see now. Come somebody. You want to see? No. You want to see? No. Yes. Come to you for take comes and do it to finish your business. Take it comes and see.
That they can. That's it. Yeah.
Come and take a chance, tell them to. You should be seated comfortably in front of the patient. The eye level should be at the same level. When you cross your nose only, you will see. Right? Come. These are very simple tests that you can perform without any instrument. It is a suspicion, right? Good. When you have much experience, you can detect the resistance also. Good. All input it and something that you heard what he said now. After the class, we have the there was a message. No need to give that is wait Now, normally, what are the normal parameters of visual field? Which one is bigger? What? Right? Yes, visual field. Now, with superior, inferior, laser, and temper. So, which one is the bigger one? Then what means? How much is? This one, 92 I was targeting the vision model. And then laser is 60, right? If you are learning already, temporal 100, laser 60, superior 60, and inferior 60 to 70. And physiological blind spot is located 15 degrees temporal fixation. Right? Now, your aggregation figure. So, okay, they does it. It's 2, 1, 2. By bus. So, only someone Monday to my class. No, all of you. From morning to morning, morning, 5 o'clock. You can just come and do join some of you can go home in person, some big classes. We really the family. And this is what I it's all coming. You also yeah, okay, technology. PDF is of technology, we say document. In short, you listen, you want to. So you experience how visual big details. Then contrast sensitivity, right? So this contrast sensitivity is so people with low vision have difficulty seeing objects of print that have poor contrast. Now the normal vision chart, whether it is high contrasting or poor contrast. High contrast. It's about 100% contrast because white, black on white. So it has got good contrast, right? But when it is poor contrast, lot of patients, people can't differentiate, right? So contrast sensitivity matters now vision clouds. Now, for example, if patient is driving, so during the daytime, but when the when in the dust, I mean in the evening time, just like our night pekari, so you don't see it properly something. So when they don't have a good contrast, it's very difficult for them to see. So contrast sensitivity matters a lot in your daily activity. Right? Now, for example, if a step is there, now you see this step is also in the same color. You can't see it properly. Instead of that, if you painted that step in white color, you can see the difference properly because it has got a big contrast with a reddish brown and white, like this wall and the floor. You get a good contrast. But now this has got a poor contrast because this white wall is also white and this is also white. Though it has got a little bit of shine, it has got a poor contrast. So if a low concentration comes, you can differentiate this difference. Right? Now, for example, if I take this here, it's a good contrast. But if I take this one here, it hasn't got that good contrast, right? So now I have put this black one, white background. You can see it properly. But if I put these two, there's no big contrast, right? So this contrast sensitivity matters a lot for motion patients. So there should be a big contrast. So to test contrast sensitivity, I mean this one is a normal parabol you get with the contrast sensitivity increases, pressure frequency increases. You get here the Hyphen's box. Okay. Picture. This is this is reducing in contrast. You can see this is this one is a software, but you get I couldn't find a picture of that. You get Leah symbols. This I showed you that same Leah symbols reducing in contrast. Right? Then there's another. It is called Terry Robinson. Yeah, so you can Google it and see. So contrast sensitivity can be tested. If contrast sensitivity is poor, that patient who is having low vision, what we want to do is you have to advise the patient to increase the contrast on objects. So right one, in your writing, you have to write is a dark black pen on whiteboard, dark thick bold pen. Right? Now if you are preparing a tea, right, you should select the red one or a brown color one because tea is white and punk is brown. And if you are preparing paint, your coffee patient should select the white one. Right? And the red or the brown color can be seen against the white background color. Like that when you serve the food loss. Now you put select a white color plate. When you put rice on it, you can see properly the amount of rice it is here. Instead of that, you select the dark color plate, and if you put rice on it, you can see the amount of rice on it. So, like that, according to his daily needs, you can advise how to increase the contrast on his daily needs. For that, you have to test with these either you have to have these testers, either a software or a Perry Robinson chart or a PR contrast chart. Have they done this loss and extra contrast? Yes, done. Okay. This again near vision testing. Near vision testing means now you saw the logma chart. So like that, you get a this is not a logma, right? This is Liasinus, but this card size one like reduced logma. So you can test near vision, and then you can measure the distance of the vision to the chart, and you record the last line period and the testing distance. Okay. Say we say the patient weighs 1 mm line, so you record 1 mm at 10 centimeters. Okay. If the patient said 2 mm at 20, so you record like this. Logma number or the unit and the testing distance, right? Then you test the near vision also. Just Shafwan, can you send me a message that including the near logma and what is visually in a given number? Then that of course we do a small lesson and those three put to the group up. Yeah, that's why I wanted to show you a video slide. Here they are the logma chart to go them to get on the other hands. Other hands also. You get units. Have you seen on the logma chart units? Second and two. I'll show you. I will show you that. 80 unexpectedly 9 units here. Units is 1 units. 1 unit is the size. You have done the minimum angle of resolution. So that is 1 minute. Right? So we can multiply some 1 minute to set like that. So that 1 minute is 1.45 millimeter size object, subject angle 95 at 1 meter distance. So that is the size of 1 meter. 80 multiplies someone millimeters. I'll show you that, so you will understand it. So near vision testing, there's another one called in-name reader. But maybe ලියාගෙන පොඩ්ඩක් Google කරලා බලන්න. Then because the time is limited only 2 hours now. So you need to see all this. In-name reader. They are symbols in this. Then the reading activity is different, right? We have this near activity first. Then you will understand when I do the next lesson. Reading activities different, right? Reading activities, now we all have different types of books. It has different grades. Sometimes the printing quality is different, right? The printed paper is different, right? Sometimes there are some newspapers that has very poor quality of the paper. Right? And in some books, you get a very big contrast and it's very clear, right? So reading activity dependent on this. The quality of the reading material, the lighting you get on the background, right? The ability of reading, and then for me the language. Now if you are reading Hindi or something which you know later, so your reading ability is poor. And if you are reading Sinhala or Tamil or first language, your reading ability is good. So reading ability is different from the near activity, right? A lot of people confuse with those things. Then is a refraction. So for low vision, now a lot of people think when you say option, just giving a device, magnifier, right? A lot of people in the private sector things like that. It's just giving a magnifier. Not so. Magnifier, maybe if you get 5 patients, 2 quality, maybe benefited with the magnifier out of the 5. But there are so many things in the field. So careful refraction is a very big step in option assessment. Why I say careful refraction? Because you know when diabetic the information comes, right? You just put lasers and if it comes to a strong seeing area, he won't see. But if you just be patient for a little while and allow him to see his seeing area and do the refractions, he will see more. Right? So, how do you do a subjective test for a person who is having six vision? What are the steps? I mean, +0.25, -0.25 like that. So, how do you do subject? I'm sure you all have that reflection. No? Yeah. Right? So, you do readiness for floor and auto reflection. Then after that, then you do the PMP test or you do subjective test. So, work on this. Yeah, let's do that. So that is important. What I done. But the simple thing you do for education. First step. Now, okay, you have done readiness for floor or first defense. You get +1, right? What do you do now? Simple steps, you put the tire frame, then move that direction, and then what you do? Ask the patient to leave the road, then one. Then तो आर +1 ना 1 महीना निकाल के then what do you do? Sorry. Silver power का card में don't get a screen power. Word only person. In multiple. Show that you. So you got readiness copy of the effect in the direction +1. So you which state with +1? Complete one you do. Yeah, reduce the power or increase the power and see. So you do it either 0.25 or -0.25 or +0.25. Now you do the time in the sum. Right. Now if you get a patient with 6 vision, you can do the subjective test, the final step, in +0.25 or -0.25. Right. But if you get a patient in 6 vision, really appreciate that 0.25 difference. This one, at 0.25, you can do the subject to define and you and you want to appreciate the 0.25 difference. Then you have to do the subject with one, either 0.5 or 0.75. Right? If you do 0.25 difference, we want one is 766. We can't identify that small. So you have to do with a bigger step. Right. If it's 360 sometimes shipping, you have to do it +1 and -1. Right? So that is why the careful refraction is important. Then okay, the cylindrical power means you can use. Right? But even when you are introducing cylindrical power, you have to be very careful with the ocean plate. Because if we are introducing another problem on so we are not going to give him a better chance. So you would have to be very careful when you give cylindrical power. You have to give whenever you have to give, you have to give. But you have to be very careful when not giving. So think of so many other things before you do that. Right? Then the thin ring trial lenses. Now like this now, the one I am there, I don't have a big green now. Now when you have a big green on the trial lenses, not the spectacles, the trial lenses, what you are doing is you are covering the chances of seeing in the seeing, right? So there are lenses has got thin ring, metal ring. So that is better if you do the subjective test with those thin brain lenses. Now, like that, when you do glasses also, if you have a big brain which is covering and making it outside, this is not so good for the on the one side, you are wearing is good because it's still big and you have more space to see. And then there are elbow clips. There are clips where you can put it in patient own glasses and do the subject. Right? So that is also good. Because he may be wearing color lenses. He may be wearing anti-reflective lenses. So rather than introducing the normal lenses, if you can put the thing onto his own glasses and do the subject with this, then we can see that these are as problems. Right. Then allow eccentric reading. Now, as we did, patient may be seen with the seeing area. Now, the patient comes with the hemianopia. Patient wants it straight away because it's, that visual field is covering his field. So, there's a seeing area here. So, you have to give alarmers for him to see that seeing. So, you have to give chance to see the eccentric field rather than saying with the macula, he will see with the eccentric, right? Then give more time. So, as we said, it's only 10 minutes for normal. Maybe he takes about 15 minutes or 12 minutes for a careful. That is very important. You have to begin with the careful proper refraction before you give any device. Okay. Then color vision. I think you have done Ishihara color vision. Then have you seen 100 give? No. Panel 15? No. So you can test 100, you test panel 15, test Ishihara. And then at least you can test functional color vision. You can have some buttons or walls, different colors. Red, green, blue and yellow, and ask it, and then can be considered. That is not a scientific test, but just a functional test, right? And then the glare sensitivity. Then some people are extremely glare sensitive. So you can test visions first, then ask them to go at least 5-10 minutes outside the sun and come again inside and test the visual ability. So if it is reduced by 1.5 to factor, it is glare sensitive. Or else the patient will come and say, I feel difficult when I go to the sun. Or if you ask from the parents, they will do this when they go to the sun, or they will do this sun. So that from the patient itself you can ask, or yes, you can do the glare sensitivities. Those are very simple tests I'm telling you. Then there's functional assessment we'll talk about later. So that is the steps of low vision assessment. Right? Any questions? No questions. I'm going to go home. So, okay. Okay.